My name is Dr. Lonnie Herman, and welcome to this website. We're going to be discussing peripheral neuropathy. And you've come to this website because obviously either you or a loved one of yours suffers from peripheral neuropathy, and you're not getting much relief with the kind of treatments that you're doing. Let me tell you about myself first before we get into what we do that's different here. My name is Dr. Herman. I am a chiropractor. I practice in Broward County. But about 2 years ago, I went back to school because I realized chiropractic wasn't helping. At least what I was doing with chiropractic wasn't helping everybody with chronic conditions, including neuropathy. I went back to school and I'm getting a PhD in functional neurology. Along this course of functional neurology, I've also been trained in how to interpret blood chemistry analysis. We're trained in functional endocrinology, functional immunology, brain and neurotransmitters, and brain function in and of itself. So we've got a very comprehensive type of program that can assess what's going on with you. We're going to discuss what makes us completely different than any other doctor you've seen. And before I get into what those treatments are, with neuropathy, you could be suffering from pain, numbness, tingling, burning, achiness that's in the hands and in the legs. And there is a problem with the ending of the peripheral nerve that could be related to different conditions like a metabolic condition like diabetes. Yet not everybody with neuropathy has diabetes. So there could be other things that are coming into play here that we've got to discover, and we're going to go over all these types of tests and treatments that we do here. Okay? But most of the time patients are under care of their general physician or some other type of doctor, and they're getting different kinds of medications. Some of the medications that I've seen patients come in here with are things like Neurontin, or Lyrica, or gabapentin. And for some people, these different medications may work. And for others, they may not. So let's understand that those medications really are medications for people with epilepsy, with epileptic seizures. Those medications are not made to cure or treat or prevent neuropathy. You've got to understand. Those medications are to treat epileptic seizures. They're not made for neuropathy. And when you understand really what's going on with your neuropathy condition, you realize if those medicines haven't worked for you, why they haven't worked. Well, let's get into what we do here so you can completely understand how comprehensive of a program what we do here and exactly how it can affect you and really help to stop the pain and suffering. And I understand when I see people come in here when they can barely walk or hold on to utensils or write their name because the neuropathy is so bad. I really see how taxing it is on somebody's life. And really, we're passionate about what we do. So let's get into what this is. We treat you metabolically and neurologically. And we leave no stone unturned to be able to figure out what is causing your neuropathy condition. I'll guarantee you that no one has ever told you what I'm about to tell you. And I'm going to address what makes my option more unique, and we're going to discuss exactly how we're so successful with peripheral neuropathy. So how do I successfully treat peripheral neuropathy? By using metabolic and neurological protocols. You've got to understand that you have certain systems that run your body that regulate blood sugars, that regulate hormones. We have something in our body that most doctors just don't understand or haven't looked into. There's a system called a neurological, immune, and endocrine axis, or we can call that for short term, the neuroendocrine immune axis. And whenever there is a neurological change that's taking place, like neuropathy, there may be an immune system flare-up that's causing this. There may not really be damage to a nerve from, let's say, a blunt trauma to the hand or a blunt trauma to the foot, or even a pinched nerve in the back like most doctors think there is, okay? So we look at the immune system and we look at blood chemistries and so on, because we've got to understand that the neuroendocrine immune axis can be stressed from anything. Hormone imbalances, you can have sugar imbalances, you can have immune cell flare-ups, you can have a nervous system just from not being stimulated properly is in parts of the brain gets atrophied. And we'll be able to understand that completely at the end of this video. Specific metabolic testing and treatments include, let's start out with, one thing that we do that's different from most other physicians is We run specific stool panels. For instance, there is a lab that we use based out of Texas that checks for your reactions to food sensitivities. And the most common food sensitivities may be with you are gluten, which is a protein found in certain wheats and oats and breads and pastas and pizzas and crackers and cookies and everything that tastes so good. Some other food sensitivities may be things like dairy. I'm not talking about lactose intolerance. There's another kind of protein that's in dairy that most people do have a sensitivity to. We also look for if there's a DNA type that's in your intestines that shows that your immune system is attacking your intestinal system. Remember the old saying, you are what you eat. So whatever is going on wrong with your intestinal system is going to directly affect how the brain is functioning or not functioning well. And if the brain is not functioning well, the rest of the body can't function well. We've got to understand that. You can't separate brain from body. So we go through a very comprehensive food sensitivity or reactivity testing through the stool analysis. Some symptoms that may occur when you're having reactions to certain foods that you eat are things like chronic pain and fatigue. You may have frequent indigestion. You may have bloating. You may have cramping. You may have frequent or loose bowel problems. You may have constipation. You have mouth ulcers or sores. Some people vomit often. Not everybody with neuropathy that comes into my office has a vomiting problem, but I have seen it on occasion with people with these chronic pain syndromes. Before we get into the blood panels that I have on the screen here, there's another type of stool analysis that we do. And the stool analysis is we check for 5 types of problems that may be occurring in your intestines that can be stressing your system. We check for parasites. We check for bacteria, fungus, and yeast. Any of these growths or invaders, so to speak, in your intestines can be stressing that intestinal system that directly stresses your immune system. Let's get into what the blood chemistry is here. In blood chemistry, we've got to understand every organ is connected. Every organ plays a role in regulating your body systems. Your metabolic systems all have to be in order for the, let's use this expression, for the whole orchestra to be playing normally. We can't have one part of that orchestra out of its normal rhythm because then we have a breakdown of other systems. You can't get normal sounds of function out of that orchestra if the man who's playing the trombone is off or the violin is a little off. You understand? So we've got to keep all these systems in order. So what we do in the office here is we run a very complete thyroid panel. Commonly when patients come in my office, I only see from their previous doctors they've had a TSH done, which is a thyroid stimulating hormone, and maybe 1 or 2 other thyroid markers are on their blood test. In my office, I've been trained with thyroid function completely. We have a very comprehensive thyroid panel that must be run. And there are articles that I have that I can show you where the thyroid under or over firing or under or over functioning can lead to neuropathy problems. And I know you may find that hard to understand, as many people do when they come in here, but when I put the pieces of the puzzle back together, you will understand completely how that can be causing the neuropathy problem, even if you're on certain medications like commonly prescribed as Synthroid or Armour. So with the thyroid panels that we run about 8 different markers. We're also going to run specific thyroid antibodies that will tell us if you have an autoimmune problem where the immune system is attacking the thyroid, which means the immune system could be attacking other glands and nerves and other parts of your nervous system as well. We run a complete metabolic panel. This will include white and red blood cells. We've got to see if there's any bacterial or viral infection in the body. If there's any kind of allergy or parasite that's attacking your system, we could find out from that blood test.